incredibly long time. Congratulations. I'm very late in that. I'll get the witnesses. That's very exciting.
Quorum being present, the Subcommittee on Health, Employment, Labor, and Pensions will come to order. Good morning, everyone. I want to welcome our witnesses. We appreciate your joining us today for an important conversation on health care and the future of the employer-sponsored coverage. This hearing furthers the goals of the Task Force on Healthcare Reform, which was established to develop a plan to replace Obamacare's one-size-fits-all with free market, patient-centered solutions. We've already held a number of meetings to take input from members, policy experts, and stakeholders, and to build consensus around policies that will deliver the results the American people want and deserve. Our vision is clear. It's time to modernize our healthcare system so we can empower every American with affordable coverage, provide more choice, promote quality for all patients, and strengthen healthcare security for retirees. Finally, as we will discuss today, we want to encourage innovation and harness the power of new technologies in order to foster lower prices and better treatment for patients. As a physician with more than 30 years of experience, I've personally seen the need for common sense reforms to strengthen our healthcare system, a system that is too costly and bureaucratic. As an elected official, I'm constantly hear from families who are struggling to access the care they need or keep up with the premiums that rise year after year after year. Unfortunately, the President's government takeover of health care is making these problems worse. Health care costs are going up, not down. Americans are seeing higher premiums. Families are losing access to the coverage they like and the doctors they trust. Small business owners are being forced to choose between providing costly government-approved health insurance and hiring new workers as they've struggled to navigate a web of burdensome mandates and regulatory requirements. And just to give an example, the city where I was mayor in Johnson City, Tennessee, had to hire a person to navigate all of this so they could figure out whether they were complying with the law or not, a city with a fairly extensive HR department. The American people cannot afford this fundamentally flawed law, and that's why House Republicans are determined to deliver meaningful reform. We have a responsibility to put our healthcare system on a better course, one that's patient-centered, not government-driven. As part of that effort, we need to understand the vital importance of employer-sponsored coverage, which ensures roughly 155 million Americans, and take a closer look at what's being done in the private sector to improve care. Employers have played a critical role in driving healthcare innovation. Despite unprecedented uncertainty in the health insurance market and drastic changes in employer-sponsored coverage, employers of all sizes are still developing creative strategies to help control costs and meet the changing needs of the workforce. These strategies include wellness programs, which are now an essential tool to help control costs and encourage healthy lifestyles. The Kaiser Family Foundation reported in 2015 that 50% of employers offering health benefits also offer wellness programs. That same year, I joined Chairman Klein and Wahlberg and introduced legislation that would eliminate regulatory hurdles to implementing these programs, and I look forward to hearing from experts today on how we can make that goal a reality. Some employers have responded to costly mandates and rigid reporting requirements under current law by putting in place private exchanges. This tool rein in costs through competition and, unlike public exchanges, serve individuals, both large and small employers. Accountable care organizations are another concept employers have adopted in recent years to improve the health of their employees and make coverage more affordable. ACOs improve patient experience by coordinating their care between doctors and hospitals and focusing on prevention and management of chronic disease. Employers are also incorporating telemedicine into their health insurance plans, providing patients more access to care at a lower cost and much greater convenience. We're here today to examine how innovations in employer-provided coverage are improving health care for workers and their families, and how federal policies can support rather than discourage free market solutions. I hope our conversation will bring us one step closer to achieving the responsible reforms the American people desperately need. With that, I will now recognize the ranking member of this subcommittee, Chairman Polis, for his opening remarks. You're recognized.
Thank you. You refer to me as Chairman Polis. Are you, I don't know if we're expecting the change or not, but Ranking Member Polis and someday Chair perhaps. But I want to thank the Chairman for convening this. This is a great conversation. I think we're all interested in the role of employers, the role of wellness. The discussion that's occurred in Congress and will continue to really runs the gamut from should employers even be involved with the provision of health care to what can employers do to encourage wellness among employees and share in the benefits of reduced costs that can accrue from the right kinds of wellness programs. I was in Congress when we passed the Affordable Care Act. I remember various predictions that occurred. Many of them were about many employers dropping health care coverage or skyrocketing costs. I'm glad to say that many of those doomsday predictions have not occurred. Of course, we can find instances of employers who made decisions to drop, employers that made decisions to add health care. But in the aggregate, for better or worse, there's not been a market shift from the employer-based system of health care. In fact, there's been a delay in the tax revisions that would have encouraged that shift to occur, namely a tax referred to as a Cadillac tax, which I think was in part designed to transition from an employer-based health care system to an individual or an exchange-based health care system. I've started several businesses myself as an employer before the ACA. I knew how frustrating healthcare costs were. Healthcare choices were difficult, expensive for small businesses. The administrative burden to small businesses, it was and is large. I certainly think anything we can do through the exchanges to reduce the administrative burden of administering healthcare programs for small and mid-sized businesses would be greatly beneficial. The fact is that receiving healthcare through employer is still the most popular option. In my home state, the proportion of Coloradans with large employer coverage is actually increasing, and it increased by about 3% over the last 5 years, and currently 156 million Americans are covered by their employers. The ACA made a number of changes, improved access to insurance. I think it's a baseline of having insured more than 10 million people, 10 million more people that we can build upon. I think we're also very interested in cost reduction measures. Wellness initiatives can certainly be among those. Last fall, as an example, my state legislature in Colorado passed a law allowing physicians to write prescriptions using remote telemedicine technology. Examples like that can be used to reduce costs. Additionally, we can share findings on things to reduce costs through the Division of Insurance and use data in pursuit of more innovative solutions to control costs. And I think that that'll be the key with regard to measuring the effectiveness of wellness programs at employers. There's a lot of hype, and we really have to see what actually accrues cost savings to the shared benefit, one would hope, of the employee and the company that offers the wellness program, with, of course, room for private contractors to make a profit as well, who actually provide those type of wellness programs. I hope that we can find a better, more streamlined way to deliver care. It's also important that we don't forget the importance of policies like paid sick leave and paid family leave that are very important to employees and important to overall wellness and job satisfaction. And want to use this occasion to remind our chair that over 40 million workers don't have access to paid sick days and paid family leave, which I think are really help form the basis of some of the important wellness policies that we need to initiate. I look forward to hearing from our witnesses, look forward to a thoughtful discussion about how we can control healthcare costs through innovative partnerships between the government and the private sector, and hearing a little bit more about the role of employer-based healthcare now and in the future. And I yield back the balance of my time.
Thank you, gentlemen, for yielding. Pursuant to Committee Rule 7C, all subcommittee members will be permitted to submit written statements to be included in the permanent hearing record. And without objection, the hearing record will remain open for 14 days to allow statements, questions for the record, and other extraneous material referenced during the hearing to be submitted into the official hearing record. It's now my pleasure to introduce our distinguished panel of witnesses. First, Ms. Amy McDonald, who is the Vice President and General Manager of Corporate Wellness at Fitbit in San Francisco, California. She works with employees and partners in corporate wellness, supplying businesses with the tools to effectively engage employees in corporate wellness programs. You have a fun job, I think. Mr. John Zern is Executive Vice President of Global Health Leader with Aon in Chicago, Illinois. Mr. Zern is responsible for the strategic direction, client satisfaction, revenue growth, and operational and professional standards of Aon's health business. And welcome. Mrs. Sabrina Collette, JD, is a Senior Research Professor at the Center on Health Insurance Reforms with Georgetown University's Health Policy Institute here in Washington, D.C. Ms. Collette directs research on health insurance reform issues and has published many papers regarding the regulation of private health insurance and the development of health insurance marketplaces under PPACA. Welcome. Ms. Tricia Franklin is the Director of Total Rewards and Employee Relations at Hallmark Cards, Inc. in Kansas City. And I think there's not anybody in here that hadn't used your product. Ms. Franklin oversees Hallmark's compensation, benefit programs, human resource information systems, and employee relations. And welcome to Washington. Now we'll ask our witnesses to stand and raise your right hand. Do you solemnly swear or affirm that the testimony you are about to give will be the truth, the whole truth, and nothing but the truth? I'll let the record reflect that the witnesses answered in the affirmative, and you may take your seats. Before I recognize your testimony, let me briefly explain our lighting system. You have 5 minutes to present your testimony. When you begin, the light in front of you will turn green, and with 1 minute left, it will turn yellow. When your time has expired, the light will turn red. At that point, I will ask you to wrap up your remarks as best as possible, and members will have 5 minutes also to ask questions. We'll begin. Ms. McDonald, with your 5 minutes, you're recognized.
Thank you, Chairman Rowe and Ranking Member Polis, for the opportunity to testify at today's hearing. As the 5th member of Fitbit, Inc. and Vice President and General Manager of Fitbit Wellness, I come today to share my passion for innovating around engaging, data-driven health solutions for employers. Fitbit Wellness, our offering for corporate wellness, was born in 2010 in response to market-stated need. We are driven by a belief that the right data, tools, and guidance can empower people to take charge of their health and fitness, and that community is key to fostering healthy behavior. With 6 years of experience behind us, we remain deeply committed to helping companies innovate in this space. We have a specific vision of wellness, one that addresses the diverse needs of both organizations and the people that power them. The fundamental goal of any wellness program should be to provide opportunities for individuals to improve their health and wellness. The need for wellness programs has never been greater, and employers are uniquely positioned to improve population health by starting right in the workplace. Wellness should always be inclusive, voluntary, and should protect the privacy of the people it is aimed to serve. While the use of our technology in the corporate wellness setting continues to evolve rapidly, the results our customers have seen so far are significant. Let me briefly share a few examples. Indiana University Health, Indiana's most comprehensive healthcare system, has been a Fitbit Wellness customer for more than 2 years. They found that 40% of participants decreased their BMI, and 60% of program participants with diabetes decreased their A1C levels. For one of our other customers, BP, who we work with through a partnership with Staywell, Fitbit data was a factor in reducing their overall healthcare spend by 3.5%. BP also saw that for employees who participated in a lifestyle management program over a 1-year period, health risks declined by 11.1%. Aperio, another Fitbit Wellness customer, cut its 2015 insurance premiums by 6%, a savings of $280,000, after showing its insured data about engagement with their wellness program, including aggregate data from the 400 Fitbit devices it had provided to its employees. Fitbit Wellness is built around the understanding that better, people-oriented technology enables stronger results. We focus on engaging people first, incentivizing health and wellness through rewarding community-driven experiences using wearable devices that consumers love. Companies have traditionally worried about investing in wellness due to lack of participation. Traditional wellness programs generally show about an average 24% participation rate. Fitbit Wellness's participation rates vary from company to company, but are often much higher, sometimes more than 80%. Across industries, we are seeing results that point to the very real ways that wellness works to keep employees healthy, reduce healthcare costs, and increase productivity. When workplaces make the healthy choice, the easy choice, health outcomes are profound. Employers are uniquely positioned to improve population health in the workplace by fostering wellness initiatives that are inclusive, fun, voluntary, and protect the privacy of the people they aim to serve. Corporate wellness is evolving as we speak and is increasingly seeking to represent a more holistic picture of what influences health. Wellness professionals are beginning to look beyond traditional measures like diet and exercise to everything from sleep and mental health to financial wellness and stress management. Wellness programs aim to help people live healthier, happier, and more active lives. Inherent in that mission is the responsibility to implement appropriate data security and privacy policies. As the leader in the connected health and fitness market, Fitbit is committed to protecting user data and ensuring that the health information tools people turn to for help are used properly. Fitbit believes that participation in wellness programs should always be voluntary. Employees should be given the choice to opt in to participate, and there should be no penalties for abstaining from participating in a program. Companies should provide participants with an understanding of how their data will be used. However, the regulations governing wellness programs are not always clear, and this confusion has left some employers on the sidelines. We at Fitbit are supportive of efforts to clarify and streamline the applicable laws and regulations that govern the structure of wellness programs. Thank you for inviting me to participate and to share Fitbit's passion for data-driven, community-oriented health solutions.
Typical of Fitbit, you finished right on time. Perfect.
Thank you.
Mr. Zern, you're recognized for 5 minutes.
Mr. Chairman and members of the subcommittee, thank you for the opportunity to testify at this important hearing on the value proposition that employer-sponsored coverage brings to our nation's healthcare system. More than 150 million Americans receive their health coverage through their employer. Facing an increasingly diverse workforce and employees' desire for greater choice and control over their health care, employers are creating a more consumer-driven experience for their employees, arming them with the right balance of tools, resources, and incentives to improve their health and their choices, along with the guidance, advocacy, and support needed for those individuals with serious and ongoing medical needs. And as a leading global provider of risk and health and human service solutions, we serve over 5,000 employers in the U.S., and we administer benefits for over 10 million employees and retirees. Employers are looking for new and innovative ways to change the way health benefits are offered. These programs include wellness, new technology, innovative delivery systems, private exchanges, and greater transparency in the cost and quality of healthcare services. While we have experience in these and other types of new innovative programs that employers are offering, today I will focus the discussion on one program in particular, AON's development of a private health exchange. Employers face a significant challenge today of providing quality, affordable health coverage for employees in our complex healthcare system. Employers are focused on promoting consumer engagement, reducing healthcare spending, and continuing to ensure that employees and their families have comprehensive coverage. Our 2016 healthcare survey reveals that employers support the value proposition of offering health benefits to their employees, and only 5% of employers say they will stop offering health benefits in the next 3 to 5 years. But healthcare costs continue to rise at a rate higher than CPI. Employers are evaluating better solutions that empower consumers with more choices in their health plan and benefit offerings. A private health exchange is a competitive, retail-based, web-enabled marketplace offering employer-sponsored group coverage. AON gives employers the ability to offer benefits through a private health exchange. These private health exchanges combine cost accountability with meaningful choice. The employer remains a vital part of the healthcare delivery system, and employers continue employer-sponsored coverage, pay the employer premium for the group, and remain subject to ERISA. Employers determine how much of the coverage costs to subsidize, and employees use this subsidy to choose from a menu of plans and insurance providers that best fit their needs and their financial situation. Employees select among varying out-of-pocket differences and network requirements. It's a win-win for employer-based sponsored coverage and for employees who have the ability to select a plan that meets their needs and the needs of their families. What we have learned is that most employees will select a plan based on their physician and provider network, their experience with that insurance carrier, the coverage of prescription drugs, and then price. Many employers that currently offer their medical benefits through the Aon Active Health Exchange are also pursuing other workplace programs that encourage greater well-being and management of chronic illnesses. Employers using the private exchange experienced a 3.3% cost increase for 2016, compared to an average healthcare cost increase of 5.5% to 6.5%. We appreciate talking about private health exchanges as one way to maintain affordable employer-sponsored health coverage and expand the role of consumers in healthcare decision-making. We're also eager to help employers find other innovative ways to engage their employees, and we urge the committee to support these efforts. Rising costs, recent market shifts, and healthcare reform are challenges to maintaining coverage for Americans. Employers are the key to the success and need flexibility in the design and management of their benefit plans. They need congressional support to preserve and enhance the value of benefit plans offered to their employees and their families. Thank you for permitting me the opportunity to testify today. I will submit for the record more comprehensive information about the development and growth of private health exchanges and other innovations that employers are adopting to engage their employees and their families. Thank you.
Thank you, sir. Ms. Collette, you're recognized for 5 minutes.
Thank you, Chairman Rowe and Ranking Member Polis, for inviting me to participate in today's hearing. As has been said, over 150 million Americans receive their health coverage through their employer. It is consistently rated as one of the most popular benefits that employers provide, second only to paid leave. In my testimony today, I'd like to emphasize two primary points. Number one, our foundation of ESI is strong in this country, but affordability remains a challenge. Number two, to address affordability requires a multi-stakeholder effort that actively engages in local delivery system reform efforts. In spite of early fears, the ACA has not caused employers to drop coverage for their workers, nor has it resulted in reductions in employment. What is clear is that employers have benefited over the last few years and a significant slowdown in healthcare price growth. But even with these promising trends, affordability remains a huge challenge for too many families. Worker contributions to premiums grew an estimated 83% between 2005 and 2015, and nearly 1/4 of people with ESI report problems paying medical bills. A report released just yesterday by the Kaiser Family Foundation finds that between 2004 and 2014, average out-of-pocket expenses for workers increased 77%, largely due to high deductibles. And people with high deductible plans report problems paying medical bills 2 times more than those in low deductible plans. Thanks to the ACA, there are some financial protections for these families with high costs, but they are still significant burdens. The bottom line is that employers and employees are struggling under high healthcare costs, and tackling affordability requires a multi-stakeholder effort, and employers have a particularly important role to play. Many employers, both on their own and in concert with other local purchasers, are engaged in innovative efforts to push back against high and rising healthcare prices, while not sacrificing the quality of care provided to their employees. The ACA has spurred activity in payment and delivery system reform across public and private sectors, building momentum to improve healthcare value. For example, a multi-payer initiative in Arkansas is leveraging partnerships with Medicare, Medicaid, state employees, and Walmart to expand primary care and medical homes. Many new models sparked by the ACA provide opportunities for employers to partner with major government purchasers to pressure providers to reduce inefficiencies and improve quality. For many employers, workplace wellness programs are intuitively appealing, and these programs, if well-designed, communicated, and executed, can make a big difference. Most of us spend most of our waking hours at work, and there is much that employers can do to support a working environment that supports health. However, some of these programs tie an employee's achievement of a particular health outcome to their health insurance premiums or cost sharing. But there's very little evidence that doing so actually improves health, increases productivity, or lowers costs. What they do instead, unfortunately, is raise the barriers for many individuals to access the support they need to achieve better health outcomes. There is also disturbing evidence that some wellness programs place employees' privacy at risk. Wellness vendors can and do harvest vast amounts of personal health information, but there is no federal law that restricts what these companies share with business partners for marketing purposes. Yet many employees face tremendous pressure to participate in these programs, especially when up to 30% of the cost of a family premium is at stake. And just as with workplace wellness programs, some benefit and network changes sound promising on the surface, but may ultimately be more about cost shifting than actually improving health outcomes. For example, network tiering has been touted as a way to encourage consumers to seek care from higher quality, lower cost providers. But there is limited evidence to suggest that providers in the lowest cost tiers are selected with quality taken into account. Their preferred status is sometimes just a function of price. A fundamental challenge for employers and their workers today is the cost of healthcare. But many proposed reforms don't get at the primary cost drivers, providers, many of whom use local market clout to demand reimbursement that is disproportionate to the actual value they deliver. And with increasing consolidation among provider systems, this problem may only get worse. Ultimately, it's going to fall to employers, in partnership with other purchasers, to drive reforms that will ultimately reduce costs and achieve better healthcare outcomes. Thank you so much for the opportunity to participate today.
Thank you very much. Ms. Franklin, you're recognized for 5 minutes.
Thank you, Chairman Rowe and Ranking Member Polis. I appreciate very much the opportunity to testify before the committee today on behalf of the American Benefits Council, of which Hallmark is a member. Briefly, Hallmark is a family-owned $3.5 billion company, as you've acknowledged, mostly in the greeting cards business and other social expression products. We have about 5,000 benefits-eligible employees and another 2,000 retirees who are eligible for our programs. Our culture strongly reflects the family ownership. Our CEO is third generation. The average years of service at Hallmark is 18 years. We are very planful and careful as we offer these programs to our employees. I want to start our conversation today focusing on our wellness programs. Hallmark has a very long, rich history of commitment to employee wellness. Hallmark even has a subsidiary company that helps other companies develop their wellness strategy and communication. Our founder, J.C. Hall, started healthy on-site food services in 1923. That tradition continues to this day. In 1956, we opened an on-site medical facility which provided employees convenience and extra care for support. These programs have evolved, and today the Hallmark Health Rewards program is a program that rewards Hallmarkers with points to be redeemed for gift cards, healthcare premium credits, and HSA contributions for participating in activities that encourage doing the right thing, getting a routine physical, attending on-site health seminars, etc. I next want to focus a little bit on what I believe has been an innovative approach to our healthcare strategy. In January 2015, Hallmark joined the Aon Private Exchange. This was a strategic decision. As Hallmark evaluated its role in healthcare, we adopted an approach of educating our employees about their choices and how to make decisions to best meet their individual needs. The complexities of healthcare, the significant changes, and the ever-growing cost of healthcare benefits resulted in Hallmark seeking this innovative approach. We had grown frustrated with increasing deductibles and employee premiums and sought an approach that leveraged market competition between carriers, simplified programs, and could change the dynamics of healthcare. The new approach allows carriers to develop services to compete in a geographic marketplace, standardizes plan design across carriers, and provides our employees with state-of-the-art decision-making tools. We moved from a self-funded to a fully insured model as part of this move, which we felt moved risk and accountability to the carriers who are best equipped to manage these complexities. We are no longer in the middle of increasingly complex decisions regarding formularies, network reimbursements, reference-based pricing, or specific appeals by employees around their coverage. We have left these issues to carriers to structure their best approach and compete for our employees' business. This model also permits our employees to post public comments about their experiences with the carrier in a true consumer feedback model. We continue to believe that employers play a critical role in healthcare, in our employees' healthcare, and I want to highlight three specific aspects. First, we provide a significant contribution to their premium. However, we pay the same funding amount whether an employee chooses the most expensive or the inexpensive or richest benefit. Employees who choose a gold option pay more from our standard contribution. Employees who choose a less costly bronze plan pay less. Second, we provide on-site and online education facilities, seminars for employees. And finally, we provide Aon's ongoing service support to answer employee questions and serve as advocates for employees. I have described for you the path Hallmark has chosen. We found that the previous one-size-fits-all approach that put Hallmark in the middle of being a healthcare delivery expert no longer worked for us. Rather, the private exchange model provides employers with this innovation. However, and this is very important, it is critical to recognize that our path is not necessarily fit for every employer. While this strategy has been right for Hallmark, other employers may decide that more direct involvement with administration and design of their benefits will result in the innovation they seek. And finally, I think it's very important to consider the legislative framework that has been made possible that makes possible affordable and meaningful benefits. And I know tax issues are not within the jurisdiction of this committee, but within our written testimony, we have highlighted two very important elements. First, the so-called Cadillac tax should be repealed, and we want to commend Congressman Courtney for his leadership in authoring bipartisan legislation to do so, and I want to thank you, Chairman Rowe, and those members of the committee that have co-sponsored repeal legislation. And finally, I want to mention the tax exclusion and how critical that is, and I'd be happy to address this during questions as well. Thank you again for this opportunity.
Well, thank you all. You've been an amazing panel. Everybody came in under 5 minutes. I hope the members will be as good as you are. I'd like to take this opportunity to recognize Chairman Walberg.
Thank you, Mr. Chairman, and the heat is on, right, to perform. Thank you to each of the panelists as well. Ms. Franklin, appreciate your testimony, and it's a Hallmark testimony.
Thank you, sir. Appreciate it.
We know that employer-based wellness programs generally have two thrusts. One, at least most of the employers that I meet in my district truly care about their employees. You might find an occasional one that's more materialistic, but for the most part, they really care about them, want them to see them be successful, healthy, and continue to work. On the other side, there are certainly cost savings to have coverage for employees that are healthy as opposed to ones that have repairable or preventable health issues. So we understand that, at least when you look at it in common sense, why wouldn't an employer want to encourage healthy employees and using wellness programs to do that? But we're also understanding now, more importantly, that there are employers that are very fearful of what EEOC is looking at, in direct contradiction to what is being pushed in the Affordable Care Act, with the First Lady's nutrition proposals, et cetera. And so with the liability concerns that go on there's challenges. I'd like you, if you would, speak more fully on the importance of employer-based wellness programs to a healthy workforce, and then secondly, what are some of the hurdles that you'll encounter as a result of what I believe is the EEOC's overreach?
Okay. Well, as I said, our programs are part of our culture. Today, as I sit here, in fact, it is the Hallmark Health Week in Kansas City, and employees are having the opportunity to do on-site biometric screening and other screenings. And it is an element where it does, I think, send a message, and this is part of our culture, that we care about our employees. And, you know, I often get asked, well, are you saving money as a result? And I have taken a different approach with that. Of course, when my boss answers that, I say yes. But I will say that what we have focused on is a program that really allows our employees who do the right thing to reduce their health care costs through these rewards. And so when you get a physical and you get a paycheck credit for doing that, it creates the incentive that we think is good behavior for employees to do that. You're right, Congressman, the myriad of legislation does create a minefield for us to work through, whether it's EEOC, whether it's GINA, whether it's other elements of this that has created that. But in the end, I think our programs do send the message that we care, and it does send the message that if you do the things that make sense for your health, you will pay less for your health care by these rewards.
And it does work, doesn't it?
I believe so.
Thank you. Ms. McDonough, as you well know, the EEOC has recently become very engaged in employer-sponsored wellness programs and will soon issue new regulations as it relates to the ADA and GINA. How is the EEOC's involvement in chilled wellness programs for you specifically?
Thank you for the question. Employers actually, and you suggested this in your introduction, employers come to us for a variety of reasons. A lot of them come for us to get more participation, more engagement with their programs. Some are looking at healthcare savings, some are looking at productivity. So they have a variety of reasons of why they're coming to work with Fitbit. And they're looking to bring something that's effective and engaging and has longevity into their workplace. In terms of how we've seen the EEOC and guidelines affect that, I think our goal and the goal of all of our employers is to make programs voluntary, to make them effective, to make them fun. But I think there is, and as I stated in my testimony, some further clarity that could allow them the ability to run more effective and engaging programs. So I think clarifying those guidelines so that they have a very strong understanding of what's within the guidelines would be very helpful for employers in developing greater wellness programs or launching them to greater populations.
Also, for the employee, it certainly makes it feel more voluntary if they understand the benefits to them.
Absolutely. Communication and transparency up front is what leads to great participation rates. So a shared commitment to health, a culture of health or wellness, and really understanding that the employee and the employer, what data is being shared, how it's being used, and how that's going to impact the culture within the organization.
Thank you. I yield back.
Thank you, gentlemen, for yielding. Mr. Polis, you're recognized for 5 minutes.
Thank you. Real interesting testimony. I wanted to address to Ms. McDonough and Ms. Franklin, obviously very exciting ways to encourage wellness and health at the employer level. What mechanisms have you seen for incentivizing employees to participate and for some of the savings to accrue to the benefit of the employee as well as the employer? We'll go to Ms. McDonough first and then Ms. Franklin.
Sure, thank you for the question. So in terms of mechanisms for and incentives that we've seen, it really does vary from employer to employer based on the sophistication of their program. So in our 6 years of history, we've had the opportunity to work with thousands of small and medium-sized businesses, as well as Fortune 500 companies. And so the way that they incentivize might be very different based on the sophistication of their program. In general, I think they try to align their incentives with the goals of the program. So that's where I think Fitbit can actually be very effective. So for example, if you want someone to take a health screening or to get more active, running a collaborative or competitive program that ties into social responsibility and other things that are part of the culture of the organization actually has everyone's incentives aligned around that good health. So that's a really common example.
In your case, they also get a free Fitbit, right?
There's a variety of models in which that works. So oftentimes it's a cost-shared commitment between the employer and
What's
the
the
employee.
typical cost of a Fitbit device?
They range between $60 and $250 based on a feature set and form
So the
factor.
employee benefit might be, half the cost of a Fitbit, so it might be $50 or $100 or something like that towards the cost of it.
That's
case.
correct. Or even less.
Or the whole cost.
So yeah,
In
exactly.
many cases. Great. Ms. Franklin?
I want to, thank you, Congressman. I want to emphasize our program is voluntary, and so the way we encourage the dollars, the rewards themselves are the biggest incentive. Our employees can earn up to $400 in a year doing the various activities. We try to, as I said, make it fun. We do challenges, whether it's 1,000 or walk to the moon. We did a walk to the moon once, and people accumulated steps as part of that. We did a lose a ton, and people came together in teams, and that was one of the more exciting ones because I think the the prize was a trip somewhere. And so it encourages people to have fun, to create networking opportunities within the company.
And hopefully where this will go, and maybe someone will comment on this, is, is tying the data about the actual savings back to what the incentive is and how that can be earned along with savings to the company. Does anybody want to address that frontier of how we can tie data back to provide the right incentive for employees and save money for employers? Mr. Zern?
I'm happy to, thank you. So there's no doubt data analytics is becoming more prevalent in the healthcare environment, and how do we tie it back to the return on investment? I think employers are certainly looking at health benefits differently today. They are looking at it more as an investment in their population and driving a healthier population, as maybe in the past where sometimes it was viewed more as an expense. The engagement of the senior leaders of employers of all shapes and sizes, they're asking those questions. They want to tie data back, and they want to understand their population across the healthiest parts of their population and those equally that need, assistance in getting healthier. So it is across the board.
And a follow-up question, and if there is a second round, we'll go more into this. I think there might be, depending on how many questions from the panel there are. But how do we weed out wellness programs that don't increase wellness? And by the way, Mr. Zern, and it seems like there would be a lot of those because there's hundreds or thousands of folks with various wellness programs, and I don't know, maybe half of them do, half of them don't, or 90% don't and 10 do, or whatever it is. But how do we actually make sure that, and by the way, the ones that don't enhance wellness may very well have other benefits like employee morale or retention or other things, but not healthcare costs and wellness. So how do we weed out, or not weed out, I guess, how do we differentiate between what a wellness program is or what is a straight employee morale retention program? Yes.
So there's no doubt the marketplace is a little crowded. But most importantly, employers are looking at how do they continue to communicate effectively what their goals are with their benefit programs. So it could take on a variety of forms: healthy lifestyle, better eating. There's a variety of them. So the challenge that I think employers face is how do they understand which ones align with their corporate goals most effectively, and then how do they communicate them? That's the big thing.
Thank you. Yield back to Councilman.
Thank you, gentleman, for yielding. Mr. Guthrie, you're recognized.
Thank you, Mr. Chairman. My first question will be for Ms. Madonna. On Fitbit, employer benefits are becoming more valuable to employees. And you described, I was going to ask you specifically of a case, but you described a case earlier of someone who saved $280,000, I think you said, because of Fitbit and the data. And I guess my question with that is, are the insurance companies you're providing, like you have it for a year, you provide the data and they expect to have lower health cost coverages because people are exercising or taking care of their health more? Or do you have to actually show, is it over a longer period of time, or you have to actually show the experience where the 1 year they start the program, the next year people go to the hospital less, therefore they know it's going to be cheaper, or are they accepting the data and have an expectation of better performance?
Sure, thank you for the question. So again, employers come to us for a variety of reasons. So they'll come to us for a true return on investment in terms of healthcare savings and costs. And we did have the example of Aperio. I'm not sure if you're familiar with them. They're a small business, 700 employees or so, very distributed population. They needed something virtual to bring their program together. So we work with a lot of companies in that size. They are looking so they were, in that case, they saw an ROI. There's also a value on investment, which termed VOI, which includes the productivity and absenteeism and those kinds of things. So employers are actually looking really holistically across that. There's not an expectation at this point for most employers that there's going to be a direct healthcare savings cost in the next year. What's great is that the data will be able to show those outcomes over a period of time.
How long did it take to get that $280,000 in savings? Was that over a couple of years or 5 years? Or?
That was actually over just 1 year. So
Just
they
1
did
year.
a 1-year program in 2014, and then that affected their premiums in the following year.
That's fantastic. Yeah, you're right in the other values there. What kind of roadblocks, if an employer wants a Fitbit or a program such as this, what kind of roadblocks do they face? Do they get discouraged, or is it they're always happy, or is everything, I know what they're trying to get to, but is there some problems to get to that point that you've seen?
And specifically, do you mean for the employee or
For the employer bringing in a program, what kind of roadblocks they may have, and they say, well, this isn't worth it, or it is worth it, or what do they have to fight through?
Sure. And I think this is now the minority, which I think is a great thing, but oftentimes they do need to sell the program up to an executive suite, into a C-suite. So there's a financial commitment, and there has to be a culture commitment to healthy employees and to really wanting to make their employees successful. So that's one. I also think that the adoption rate, so the 24% average participation, can sometimes be a barrier. But again, when you're bringing, that's what's great about bringing consumer technology into this, is that you're being able to capitalize on a movement, literally, that's already happening in the marketplace, and being able to bring that and increase those participation rates. So I think by bringing those technologies into the corporate marketplace, we're able to push back a lot of those objections.
Thank you very much. And so, Mr. Zern, during your open enrollment period, have you seen employees change coverage from year to year? Do they shop around like year to year? And what kind of drives them? Is it the network choice, the cost, or they had a pleasant experience with a carrier or an unpleasant experience with a carrier and want to just change insurance companies because they don't want to?
Sure, thank you for the question. And it's all of the above. In our active exchange, I think that is one of the liberating things for the consumer, for the employee. And what the employer community really likes is that it gives a tremendous amount of choice to the employee, supported by very strong decision support tools. So left to their own device, it can be overwhelming, but with great decision support tools, you get employees they normally start with what's the right level of coverage for their situation, whether they're an individual or their family situation. Then they will go into looking at networks, their experience with insurance companies. Our survey results show that price is really kind of the last determinant of their selection. So it's plan design, then it's network and experience with the insurer, and then it's cost.
Thanks. And understand, I'm in manufacturing business, or I was, and in human resources involved, and here's the health insurance plan, and people just took it, and you move forward. I understand you allow the employees to rate the carrier. Has that changed the insurance company's behavior by actually having ratings from their customers?
It is it's one of our newer parts of the innovation of our active exchange. Consumer ratings are certainly piquing the attention not only of our insurance companies that are part of our exchange, but also their employers. I think that is also factoring into how they view their partners on the exchange. So it really kind of cuts across all the key stakeholders, from the employer, provider, and the insurer.
It's really bringing the customer into the mix, and that's innovative and appreciative. And I ran out of time, so I yield back.
Thank you, gentlemen, for yielding. Ranking Member Scott, you're recognized.
Thank you, Mr. Chairman. And I think it's important to remind people where we were when we passed the Affordable Care Act. We were experiencing cost increase routinely in double digits for thousands of people. Some 1,14,000 people a month were losing their insurance. Those with pre-existing conditions, if they could get insurance, they paid exorbitant rates. They usually couldn't get insurance, and millions others did not have insurance. The proposal for a government takeover, single-payer plan could have solved these problems, reduced overall health care budget significantly, but the government takeover didn't pass. We instead passed a more modest, market-based approach, patterned after Romney Care in Massachusetts, a Republican plan, but that's been successful. The costs have increased since the Affordable Care Act, have been the lowest in decades, probably half a century. Those with pre-existing conditions can get insurance at the average rate. We have the highest portion of people with insurance in recorded history. Children up to 26 years old can stay on their parents' policies. Women are no longer paying more for insurance than men. We're closing the prescriptive drug donut hole, preventive services. Annual checkups are without copays or deductible. And since the Affordable Care Act, those that had warned of job loss are forced to explain the longest continuous number of months of job growth since records have been kept. So that's where we are in since the Affordable Care Act. Ms. Collette, can you, one thing that has not been completed is the Medicaid expansion. Some states have not expanded Medicaid. Can you comment on the effect that has had on people who are in the gap for insurance for the in the Medicaid gap that is caused by the failure of some states to expand Medicaid?
Certainly, Congressman, and thank you for the question. I think this is something that I hope that Congress will address soon in whatever way it can, and also for the states that have not yet expanded Medicaid. This is a true moral failing, I believe. We have, I think, an estimated 3 million people who, because their incomes are too low, cannot get access to the kind of help with premiums to buy health insurance that people who have incomes above 100% of poverty have. And I think that kind of inequity is simply wrong, and it's also demonstrated that it's having not just an impact on the families that can't afford the insurance, but actually on many local providers, hospital systems, and others that are really suffering because the people that they serve cannot afford the care.
The failure to expand Medicaid also affects those with insurance because they have to cover the cost shifting. People who are in the gap without insurance get sick, go to the hospital. Can you make a comment on that concept of cost shifting?
Sure, and that is a problem. I don't know that it has been exactly quantified, but essentially the problem is that just because you don't have insurance doesn't mean that you don't ever have health problems. And so what happens is that many people, because they can't pay for care, they wait until the last possible minute when the problem has become perhaps even a crisis or much more severe than it otherwise would have been. They must go to the emergency room, and somebody's got to pay for that care. And typically what the hospital does is shift those costs over to other payers, privately insured and other payers. So we all pay for it in some way, and so it's penny wise and pound foolish for these states that have not expanded to continue to fail to do so.
And Ms. Collette, can you make a comment on the issue of privacy in the wellness plans, whether or not people are coerced into revealing private information as a result of participation in wellness plans?
Sure, absolutely. So I should just first of all say that I think workplace wellness programs can be incredibly important and effective. But you have identified one particular area of concern, which is that under current federal rules and under the proposed EEOC rules, somebody, so for example, somebody making $50,000 a year could be asked or told that if they don't complete a health risk assessment or if they don't agree to have personal health information turned over to a wellness vendor, as much as $5,000 of healthcare premiums could be at stake. In other words, they could be asked to pay more, more in health premiums, as much as $5,000 or more. And it's really hard for me to understand how that would not be considered coercive for somebody making that amount of money. I think they would feel under tremendous financial pressure to complete that health risk assessment and participate. So to me, that is not voluntary and does not fall under anybody's common sense definition of what voluntary means.
Thank you. Mr. Chairman, can I ask unanimous consent to enter two documents for the record? One, a comment to the EEOC regarding the proposed rule on wellness programs and its effect on the Americans with Disabilities Act, and another comment to the EEOC regarding the proposed rule relating to wellness programs and the Genetic Information Non-Discrimination Act.
Without objection, so ordered.
Thank you.
Mr. Carter, you're recognized.
Thank you, Mr. Chairman, and thank all of you for being here. This is certainly an important subject that we all need to be paying particular attention to, and I want to thank Chairman Rowe for his efforts in bringing this to light before this subcommittee. I'm a small business owner. I'm a pharmacist by trade. I own my wife now owns 3 independent retail pharmacies. with about 19 to 20 employees, and we value that relationship very much between with our employees. And you know, some are very long-term, been with us for 28 years, and that's certainly very important to it. And their health is important. Their health is important to me as an employer. I need them to show up for work. I depend on them. Obviously, I couldn't do what I'm doing here without them being there. So this is, you know, very, very important. However, like all small business owners, I've been faced with the dilemma of trying to reduce healthcare costs, and that's something that has really been a struggle recently, as you can imagine. I'm not any different from any other small business owner in that respect. Ms. McDonald, I want to speak to you. First of all, I think we're all familiar with Fitbit and what it does and the benefit that it can have. And, you know, as we get to a more socially conscious healthcare society, if you will, these are the type of things that we're looking at. And I'm concerned because not concerned, I'm just inquisitive as to the collection methods. As I understand it, if I were to provide my employees with the Fitbit, if I wanted to get the information, I'd have to get their permission to get it, first of all?
Absolutely.
Okay.
Yeah.
I'd have to get, in that data that's relayed to me, how can we make sure that it's going to be private and it's going to be secure? They're going to want to know that. They're going to, and they should. If they don't want to know it, they should want to know it.
Absolutely. So privacy and the security of our users' data and the trust of our customers is paramount at Fitbit. So we have a very clear, easy to read, friendly privacy policy that we share with all the consumers. It's written in plain English so that they can understand that. And that's for all the consumers who use Fitbit products. When we work with an employer on an employer wellness program, they actually have to opt in and give active, explicit consent to share data with their employer. And that it's a subset of the actual data that's collected by Fitbit overall. So some of our devices collect things like heart rate or GPS when you're out running, if you're using that functionality. That data is not shared with an employer when they work with Fitbit directly. The type of data that might be shared would be steps and distance and active minutes. So data that would be beneficial and useful for them to run an effective and engaging program. The employee has the opportunity to, again, the programs are voluntary, so they do not have to agree to share their data, and they can also opt out at any time.
Okay. One final question for you. As a small business owner, we've asked about the barriers that employers have, but what about small business owners? What kind of barriers do they typically have?
I'm so glad you asked this question because I'm really passionate about supporting small businesses, and I actually think that it's through the use of technology that small and mid-sized businesses can actually have really effective wellness programs. There's a number of vendors who will only work with very large employers. We work with, and we are ourselves a small business. So that's I'm very passionate about it and really excited about it. The barriers tend to be that it's one person who's responsible for all of HR and benefits and snacks.
And that's usually the owner.
Exactly. So you've been there. So what's great about the advent of the technology that we can provide is that we make it very easy and streamlined, and we take a lot of the pain points for the small business owner, and we actually solve those for them.
Great, great. Very quickly, Mr. Zern and Ms. Franklin, I know that the private exchanges, they offer a lot more flexibility. And I'm just wondering, and Ms. Franklin, I believe that Hallmark has recently changed to a private exchange, and I'm just wondering the experiences you've had with that.
It has, thank you, Congressman. It has been a very positive impact to our workforce. It's given employees the opportunity to learn how to determine what healthcare plans best meet their needs. It's not a one-size-fits-all approach, as I mentioned, and it very much empowers the individual to be part of the process, and that has been very, very valuable. It gives our employees choice. They can choose from a variety of national or even local carriers, and I think it introduces the opportunity to truly make healthcare a consumer-focused product for
Great. Thank you. And Mr. Chairman, I yield back.
I hope your new HR director is doing okay at your business.
You know, I got problems with it, but I'm dealing with it.
Mr. Courtney, you're recognized.
Thank you, Mr. Chairman, and thank you to the witnesses for your outstanding testimony today. And again, just to follow up on Mr. Scott's comments, I come from the state of Connecticut, which is a state that fully embraced the Affordable Care Act. In 2010, our uninsured rate was about 9%. Last fall, the latest statistics that came out, it's now 3.8%. The exchange, which again I think has been touted as the highest functioning exchange in the country by Forbes magazine, the individual policies, private policies that were sold through the exchange, the actual premium price went down by 5%. I want to say that again, went down by 5% in terms of what was offered last year. And again, like many of us, I'm a former employer and believe in the employment-based component of the system. Again, what we're seeing in Connecticut is that despite some of the hysteria, that employment-based benefits are alive and well, and that some of the really good, solid initiatives like wellness programs or private exchanges are totally free to operate, and that's all good. There are, like any measure, particularly one that had 440 sections, there are provisions which even those of us who voted for it had concerns with, and as was mentioned by Ms. Franklin, the excise tax, which we pushed against the administration back in 2010 and got delayed till 2018. We, again, succeeded last year in terms of delaying it to 2020. H.R. 2050 has 186 co-sponsors, 70% of the House Democratic caucus to strike this provision from the law. And there's nothing, I think, contradictory about that. As I said, any law, it always can use, sprucing up and improvements. And the administration, actually, with their budget that came over this year, kind of acknowledged some of the criticisms that we've been weighing against it, because they at least tried, I think vainly, to come up with some actuarial adjustments, which again, I just think at the end of the day is just not really, no one's that smart and no one is that capable in terms of coming up with those kinds of fixes. So we should strike from it. But, stepping back and looking at the big picture, one of the things that, again, was predicted was that it was going to, be this huge negative impact in terms of America's healthcare sector. Last month, the Bureau of Labor Statistics, which came out with, again, another positive jobs report, 215,000 jobs added to the U.S. economy. 37,000 of those jobs were in the healthcare sector, 10,000 in hospital, and about 27,000 in ambulatory care. And in the hospital sector in the last 12 months, the employment in that sector has grown by 183,000 jobs in the last year. Mr. Chairman, I'd ask that those figures from the BLS be entered into the record.
Without objection.
Right. So again, we've still got work to do to make improvements, and but there's no question that certainly, when people actually step up and figure out how to make it work, as in Connecticut, both in terms of cost and access, I think we can point to real tangible results. So, Ms. Corlett, just to shift the conversation a little bit, we also are a state that was the first to adopt paid sick leave of up to 5 days. Very controversial when the state legislature passed it. There was a business survey that was just done recently. 3/4 of employers now in the state support it. And I just wonder if you could talk about, that sort of feature as a way of improving workplace coverage and health and wellness.
Thank you, Congressman. So in full disclosure, this is not my area of expertise. My area of expertise is health insurance. But as I did note earlier in my testimony, paid leave is often changes places year to year as the most popular employee benefit that employees cite as something they appreciate about their employment. So I can really only speak as an individual about the importance of paid leave, and also as a mother, and how critically important it was to me after I had my children. I would also say, as a consumer of goods and services, I would like to know that the people that serve me in restaurants and establishments are not working because they're sick, because they can't afford to take a day off to get better. So That's the best I can do.
Right,
Unfortunately, it's
that's fine.
outside my
I appreciate
expertise.
that. The, what's interesting is the survey that took place that I mentioned a moment ago, a third of employees who are eligible to use the statutory paid leave didn't even use it. So again, the notion that it's going to just trigger this, huge utilization, in fact, hasn't happened. People are committed to their jobs, but they, like you said, they should not be forced to be there when they're too ill to do it at the highest level, and also to keep the public safe. With that, I yield back, Mr. Chairman.
Thank you, gentlemen, for yielding. Mr. Allen, you're recognized.
Thank you, Mr. Chairman, and obviously we've had to tip the scales of health care prevention toward health care prevention. In fact, one of the early meetings with the most recent president of our medical school in Augusta, I think he said then that we were spending about 25% of every health care dollar on preventive and about 75% on critical, and we could cut health care costs tremendously if we could just move that to 50-50. And he felt like that was possible. So, Ms. McDonough, I've been very interested in what you've had to say about that, and congratulate you on your work. The public Obamacare exchanges are failing, as we all know, and I actually introduced legislation, the Transparency and Accountability of Failed State Exchanges, H.R. 4262, that requires failed state exchanges to return unused federal funds for deficit reduction, requires an audit of how federal taxpayer dollars were spent. In our own state, our governor was criticized for not opting to take the federal dollars and to open up a state exchange, but he obviously knew in Georgia we have to balance our budget, and he didn't want to have to write a blank check. We know that Oregon now is wanting to opt out, as well as Kentucky. Mr. Zern, can you talk about your free market competitive exchange and how it saves employers and employees money, and how that might help, how having these private exchanges influence employee choice for health care?
Sure. Thank you for the question, Congressman. So I would first start by establishing that our exchange is an employer-sponsored group plan, compliant with ERISA. It has some core themes or governing areas to it that I would share. First is standardized plan designs that really help the employee navigate the various choices. Secondly is multiple insurance companies offering networks. So there's different network options for the consumer from which to select. The third is around strong decision support tools. So if you think about consistent plan designs, multiple carriers with network options for the consumer, and strong decision support tools, what those really lead to is an outcome around the engaged consumer and the empowered consumer, making a choice that works for them personally and their family situation. It addresses choice, which all of our survey data shows that employees and employers want to offer more choice around plan designs, multiple networks, and then it gets to transparency around cost and quality, which is the kind of the third key governing thought for me. So our exchange, as I mentioned in opening comments, is driving 100 to 200 basis point reduction over the standard healthcare cost increase.
And one thing I found about the American people is they want choice, and that's the big problem with a mandatory government health care program. We know in the business world, and we talked about it, that...
Congressman, could I just tag on to that very, very quickly?
Yes.
One other element that I think is fundamental in the private exchange is that there are different geographic markets. And our experience when we moved to the exchange is that not one carrier has the best price everywhere.
Right.
And so by having the localities compete, there's an opportunity for better products and cost savings there as well.
Well, we're having problems in Georgia, frankly, because of the status of health of a lot of our citizens there, and particularly in my district. You know, we know that the only way to bring down costs in the business world, which I've been a small business owner for years, is by competition. And of course, the health insurance industry, they're consolidating as we speak. There are less and less companies offering health insurance. Their companies are also saying that they're going to get out. They're not going to serve this area or this exchange, or they're just making calls. And how do we, Mr. Zern, I'll start with you, and we've got just a few, how do we introduce competition back into the marketplace? For example, ophthalmology. To get your vision corrected, it used to cost $3,000. It's a couple $100 today. How do we do that real quickly? You got 25 seconds.
Sure, I would say that our active exchange, absolutely, the fundamental piece is promoting market competition amongst the insurers. And quickly, on behalf of our employers, when the announcement was made about potential consolidation, we did 2 pretty significant surveys. And the information coming back from employers is they're kind of on a wait and see as to if consolidation happens, what that's going to mean. But none of them stopped advancing their healthcare strategies. Not a single one.
Thank you very much, panel, and I yield back, Mr. Chairman.
Thank you, gentlemen, for yielding. Ms. Bonamici, you're recognized.
Thank you very much, Mr. Chairman, and thank you, Chairman Rowe and Ranking Member Polis, for holding this hearing, and thank you all for your testimony. It's been great to hear about some of the innovative approaches and the work that several companies are doing to make sure that they have a healthy workforce. My home state of Oregon has often been a leader in finding more efficient and effective ways to deliver health care and improve health outcomes. And following up on Mr. Courtney's comment, our Oregon legislature did just pass paid sick days, which is really important to make sure that we have a healthy workforce. We also in Oregon expanded Medicaid. Our year between 2013 and 2014 saw a 63% drop in the number of uninsured in Oregon. So recently I visited a company called Provada Health in Oregon. It's an Oregon-based health technology company focused on workplace wellness, and they use digital technologies. They have an evidence-based series of wellness programs that are scientifically designed to create a healthier and more productive workforce. They've been the subject of peer-reviewed studies, showed both increased cost savings and improved health outcomes. So I wanted to ask first, Ms. Corlett, can you talk a little bit about how employers might evaluate the potential cost savings? And what kind of methodologies could be used to determine those?
Thank you, Congresswoman. So we are in an interesting time when it comes to workplace wellness programs. There are right now in the marketplace, it's like 1,000 flowers are blooming. And that kind of innovation is both very exciting and provides some great opportunities, but I also think that it can be very difficult, both for employers as well as employees, to sort of tease out of this myriad programs that exist, what are the tools and incentives that really work both to change behavior, get to better health outcomes, and ultimately get to a lower cost growth trend. And the truth of the matter is that the research out there is growing, but it can be very difficult to tease out what's working and what's not. I will say that what we are seeing is, first of all, that wellness programs that are tied to some sort of premium-based or cost-sharing-based financial incentive have really not been shown by themselves to change behavior. What does seem to work in terms of cost reduction, of course, are targeted disease management programs that really target, for example, people with diabetes or heart conditions, that kind of thing, with direct and personalized interventions. Also, frankly, changing the environment. Google is a great example of a company that has, experimented with different wellness things, but one thing they found one of the most effective things, in their cafeteria, they moved all the healthy options up front, took the unhealthy options and sort of hid them in the corners. They reduced the sizes of plates and bowls, and that has made a tremendous difference in people's nutrition and overall health. So those kinds of environmental changes sometimes are very easy to do, but can be incredibly cost effective.
And I know just a few days ago, the Center for American Progress talked about some of the state initiatives. Can you talk a little bit about some of the successful state models that we've seen?
Sure. The ACA has really sparked a number of really innovative and exciting payment and delivery system models that are happening at the state and local level. And here's an area I think where employers are really critically important participants in those models. What the ACA has done is brought big government purchasers like Medicare and Medicaid to the table. But from providers' perspective, when you have Medicare telling them to do one thing and the commercial carriers telling them to do something else and Medicaid yet another thing, those signals can get very confusing and administratively very burdensome. So when the signals are aligned, and you're encouraging more efficiency, higher quality, that can lead to both better health outcomes and lower costs.
I'm going to try to get one more question in. We have a need for more healthcare literacy, and the Uniform Summary of Benefits and Coverage that was created under the Affordable Care Act, I think has made a difference. Can you discuss how that tool for workers can help them make more informed decisions, and are employees more confident in selecting a health plan now that will fit their specific needs?
Thank you. So polling does show that the SBC, or Summary of Benefits and Coverage, is consistently one of the most popular provisions of the ACA. I think people are really excited for sort of standardized, uniform information that just says, okay, what does this plan actually do for me?
Do the employers on the panel agree with that? I mean, any
Yes,
disagreement with that?
very similar feedback.
Okay, terrific, thank you.
I would add that decision support tools that are made available also encourage that kind of education as well.
Terrific, thank you. My time has expired. Thank you, Mr. Chairman.
I thank the gentlelady for yielding. Mr. Messer, you're recognized.
Thank you, Chairman. Fascinating conversation today. You know, as we look at how do we control costs in the world of healthcare, I think most of us would concede that one of the most important things we can do is turn every American who receives healthcare into a healthcare consumer, where they're actually making consumer decisions. At the same time, Mr. Zern, as you highlighted in your testimony, you have over 150 million Americans getting employer-provided health care. That's an important part of our system. You mentioned in your testimony that employers offering health care benefits are genuinely driven to promote health care awareness, reduce health care spending, ensure that employees and their families have comprehensive coverage, and the like. There's been a lot of discussion lately about the overall viability and future role of employer-placed health care, and I was hoping you could just highlight for the panel, how do consumers behave differently when coverage is provided by their employer versus when they purchase health insurance on their own?
So I will be able to speak from the employer side, certainly. I think healthcare is complex, and employees look to their employer to continue to educate and communicate with them around a variety of issues, whether it's plan design, whether it's network configuration changes, what type of wellness programs I should be accessing or thinking about. So the employer is, to me, exceptionally critical to continuing to advance the communication and the empowerment of the consumer. We have the next stage, I think, that we really have to tackle is how do we get information in the hands of the consumer at point of service, right? So when you look at the waste in our healthcare system, how do we start to address that? And I think that's the next set, and you can see that in innovation through mobility apps and different things of that nature. But the education piece from the employer to the consumer is a critical function for us.
And so following up on that, what are some of the obstacles preventing employers from signing up for private exchanges that you could identify?
So, you know, I think to Ms. Franklin's comments earlier, private exchange is a great solution for a particular client. I've been in healthcare consulting for close to 30 years. I've seen lots of different plan designs, and an active exchange or private exchange is a really good one that drives consumer engagement, transparency, and choice. So I think we're going to continue to see the evolution of exchanges, both public and private.
Yeah, and I'm open to both Mr. Zern and others on the panel. I mean, we're here obviously today in Congress. What could Congress do to enhance the opportunities or to eliminate barriers for employers to be engaged in private exchanges?
So I'm happy to jump in on that one, representing our, the employers who are our clients. I think there is a desire for trying to drive a little more simplicity in the system. And so that would be an area that we would be happy to work with Congress on behalf of our employer community too. How do we simplify some of the regulatory issues that our employers have to face that can push them to look at other areas, whether it's active exchange or other areas of innovation within the healthcare ecosystem.
Presume part of your point there is that when it gets so complicated, the individual employer just throws up their hands and decides to...
It can be a little frustrating.
Yeah. Anybody else? Oh, okay. Well, thank you. I'll yield back the balance of my time, Chairman.
Thank you, gentlemen, for yielding. Mr. Hinojosa, you're recognized.
Thank you, Chairman Rowe and Ranking Member Polis. The health insurance landscape has changed tremendously for employers and employees since the Patient Protection and Affordable Care Act implementation. Just last month, we celebrated 6 years since ACA's enactment and celebrated the 20 million previously uninsured Americans who now have access to quality, affordable coverage. In my region of South Texas, from San Antonio down to the Rio Grande Valley, we have close to 200,000 families receiving tax credits to help pay for coverage. In 2009, prior to ACA, 40% of the families in my congressional district were uninsured. Today, in 2016, only 20% are uninsured. So we've made great progress in this large region that has been growing so fast. Today's hearing focuses on alternative insurance models for employer-provided health coverage, but in my view, any changes to employer coverage must be handled carefully, as over 147 million people currently rely on employer-sponsored benefits for health needs. As you well know, the governor and the Texas legislature did not embrace ACA in our state, and they did not allow expansion of Medicare, nor did they allow creation of the Texas Health Insurance Exchange marketplace. However, in spite of those actions, Texas saw 1,306,208 people enrolled in private plans for 2016 through the Texas Exchange during open enrollment. So I'm encouraged that we are doing some things right and helping a lot of people who, under the conditions that our ranking member Bobby Scott gave, that couldn't afford it or had pre-existing medical conditions, are now covered. And so my question that I have goes to, I got my papers a little mixed up here, excuse me, to Sabrina Corlett. Based on your expertise, how can Congress work together with healthcare service providers to ultimately reduce the cost of healthcare experienced by patients?
Thank you, Congressman. As I mentioned in my testimony, I think one exciting thing, but often underpublicized, about the Affordable Care Act is that it really launched a number of experiments in payment and delivery system reform that are bringing both public purchasers like Medicare and Medicaid, along with private purchasers like employers and employer coalitions together to start to work towards increasing healthcare value. And by that, I'm talking about things like patient-centered primary care medical homes, as the chairman mentioned earlier, accountable care organizations, efforts to really, let's re-emphasize primary care, start putting more accountability into the system, reduce unnecessary and wasteful care. And these experiments are still in early days, and so they're showing, we're starting to see some results, but still more time needs to tell. And I think one thing that was really exciting about this particular hearing is the role of the employer, and particularly self-funded employers, and how influential they can be at the local level in really driving change towards value and value-based care.
I agree with you, and I want to be sure that the record reflects that across all 38 states that use healthcare.gov, in the final week, the 2016 open enrollment period, 8 of the 10 local areas with the fastest growing enrollment numbers were in Texas. It included Corpus Christi, Harlingen, Laredo, El Paso, Odessa Midland, San Antonio, Abilene, Sweetwater, and Lubbock. So I'm encouraged. I am an optimist, and I believe that if we can just tweak ACA a little bit, that we can make it work for so many more people. And with that, I yield back, Mr.
Thank you, gentlemen, for yielding. Mr. Grothman, you're recognized.
Thank you very much. I guess what we're coming down to is what we can do to make health care affordable. I guess I strongly agree with Ms. Corlett that we're in the beginning stages of that. I think there are a variety of companies out there, Serigraph, owned by John Torinas, and in my neck of the woods, who've already found ways to greatly reduce the cost of their health care per employee. But I'll give a couple of you guys, you can kind of rattle off what your total cost, not just the cost of the employer, but the cost of the employer plus employee is in each one of your businesses, or if you don't have, I guess you all have businesses of one nature or another. We'll start with Ms. Corlett, because I just finished up with her. What is the total cost per employee at Georgetown University?
I'm sorry, sir, I actually don't know. I'm not here to represent the university, so
You never looked into it? Okay.
I don't
Well,
know.
it's an important number. We should all know that. Ms. McDonough, what is the cost for health care at Fitbit per employee in the programs that you cover?
Unfortunately, I'm also not able to speak to that because I don't sit within the HR organization.
Oh, okay. Well, Mr. Zern, do you know?
Unfortunately not.
We need new witnesses. Ms. Franklin, do you know in Hallmark what is your total cost?
Yes, sir, I pay those bills. It's about $9,500, $9,800 per employee per year.
And that includes the cost the employee is paying?
No, that is just the Hallmark cost.
What is the cost for employee?
You know, that's going to, I don't have that on an average basis because employees can enroll in different levels of coverage, so apologize.
You should keep track of that. Well, it's a little bit embarrassing because what I wanted to do is I wanted to talk about the difference between cost in corporations, what they are, and cost in government, cost in Medicare, and what they could be. What they could be if you combine an HSA, you combine it with a wellness program, you combine it with an on-site clinic, and you did some sort of co-pays so your employees could shop for the lowest cost health care. Since none of you know the answers, which you all should, since you're experts in the field, I can tell you I think a lot of companies could drop their total cost from about $20,000 to $12,000 an employee. It'd be a difficult thing for the government to do because the government is so big, but I think if you had your own on-site clinics without the incentives to send people to expensive specialists, if you did a little bit of wellness, you did an HSA so people had a little bit incentive not to run to the doctor at a drop of a hat, you'd be amazed how much you could find drop in healthcare costs. And it can be done for non-profits too. I think, Ms. Corlett, if you get involved in Georgetown's health insurance, I think you'd find you could save a lot. And I know a lot of universities today claim that they need more money and tuition is so high. But you might find, Ms. Corlett, I recommend you read Mr. Torinas' book, you might find you could save $6,000 or $7,000 employee at Georgetown and not have those kids graduating with such excessive debt. But since we don't have people know that, I guess I'll give back the remainder of my time, because that's what you should focus on. Total cost, including cost paid for by the employee in your businesses, and see what you can do to drag that down. Thanks so much.
Thank you, gentlemen, for yielding. Mr. Takano, you're recognized.
Thank you, Mr. Chairman. Following up on my colleague, Representative Bonamici's comments about health literacy, Ms. Corlett, I wanted to relate some of the experience in my own home state of California, where Covered California recently announced, Covered California is the name of our exchange, recently announced that its contract with insurers for plan years 2017 and through 2019 will include expanded tools to help consumers make their choice in plans that's best for them. Can you discuss how improving health literacy is a tool for workers to make more informed health care decisions?
Absolutely, and there are a number of exciting components to that Covered California contract for 2017 that include both the more support for consumers to make smart choices, but also really starting to align incentives for insurance companies to start to deliver better value. So I commend California for really being a leader in this area. On the issue of health insurance literacy, what we have now learned after a few years of enrollment through the health insurance exchanges is that there really isn't much health insurance literacy in this country, unfortunately. And part of that stems from the fact that health insurance is such a complicated product. You're talking about premium, deductible, co-insurance, co-payments, network issues, benefits. It's just very, very complicated. And then you couple that with, once you're enrolled, figuring out where is the appropriate place to get care. All of these things require a tremendous amount of knowledge on the part of the consumer. And so one of the things that the ACA has tried to do is provide more tools to consumers, such as the summary of benefits and coverage, to help them make informed decisions. But we're still a long, long way away from really getting to the decision support tools that are needed.
Now, this may be an obvious question, but I think it's important for us to kind of get the thinking out there. For the public, I want to ask you a follow-up. How does improved health literacy help to keep costs in check?
Well, I think first and foremost, by helping people understand where an appropriate care setting is for a particular injury or illness or condition, that can help people get the right care at the right place at the right time. So, for example, you shouldn't go to the emergency room for a sore throat, or if you've got the flu, you should go to a primary care setting, and that can lower costs dramatically. So that's just one example. Just educating people about where the right place is to get care for a particular condition is important.
Because people who haven't been insured before really don't know the different aspects of a healthcare system.
That's right.
They need to learn these things. These terms, copay and coinsurance, all new to someone who's not really been insured before. Had we not acted and passed the ACA, do you believe premiums for workers likely would be higher than they are today if we hadn't acted?
Well, since the ACA was enacted, we've had the slowest growth in healthcare prices in about a generation. It's really been remarkable, and some attribute that to the ACA. Some say it's the economy and other factors, but we certainly have seen much, much slower growth than we had prior to the ACA. I think that one of the other exciting things about the ACA are these multi-payer efforts where private purchasers are pulling together with Medicare and Medicaid to start to get more efficiencies into the system. Those are still in their early stages and need some time to bear fruit, but I'm hopeful that we can, as I say, bend the cost curve for the long term.
One thing we know for sure is that the sky didn't fall, the world didn't end, and we're not seeing lots of people being put out of work, lots of full-time people being moved into part-time jobs. All these claims that were made pointing to dire disaster have not occurred.
Quite the opposite. We're seeing job growth and a really strong foundation of an employer-sponsored healthcare system.
Well, thank you very much, and I yield back my time.
Thank you.
Thank you, Mr. Takano. I'll now yield myself 5 minutes. Why do companies form wellness programs? Well, I think they do that, which is what the subject of this was today, was to lower cost and improve the health care for their employees. I think that's why we do it. It makes sense to do it. Just to point out something, I think the way you do that, you all have clearly pointed out, which is empower consumers, transparency, and quality. If you do those things, people can shop, and Americans are the best shoppers in the world. We'll drive across 5 lanes of interstate to get gas 2 cents a gallon cheaper. So I know if we have the knowledge, we absolutely will make smart consumers. I'm a smart healthcare consumer. I have an HSA. And what did the Affordable Care Act do? It discouraged consumerism, me being able to be in charge, not the insurance company, not the government. And one of the things you can do tomorrow, we could do tomorrow, is allow people to shop. In other words, I'm forced right now to buy 10 essential health benefits, half of which I don't need. And we need to allow consumers to purchase what they and their family can afford and what they need. And let me just tell you what's happened in the real world. This all sounds great. In the real world, in the hospital where I practiced and taught at the medical school, 60% of the uncollectible debt in that hospital are people with insurance. And why? To meet these benchmarks of affordability, you've raised the copays and out-of-pockets so high that people can't afford it. And so now it's left to providers, me and the hospitals, to provide that care when people can't pay it. If you have a $5,000 out-of-pocket, and you're a police officer where I live making $35,000 a year, it might as well be $100,000 out of pocket. You don't have the money to pay it. And we've got to factor that in and figure out how not to do that. And I think having consumers decide what they need to buy is the way. Medicare, for instance, Medicaid, for instance, we tried that experiment 20 years ago. Right now, with the federal government running a deficit and paying all the bills, it looks fine, except the quality of care for Medicaid patients in many cases is actually less than people with no insurance. I find that abhorrent that we have people in this country with Medicaid who get a lower standard of care than other people. I think that's absurd, and we need to reform that program before we expand that program. It almost bankrupted our state of Tennessee, which is why we haven't expanded it yet. So just a few things like that. I want to get back to a couple of questions that I'd like to ask. And by the way, the exchanges, which I found amazing, you all have set up these private exchanges at zero cost to the taxpayers. And we literally have flushed billions down the drain with the public exchanges. And by the way, one of them was Oregon. Hawaii, I could go on and on. The co-ops, over half of them are bankrupt and out of business. We need to let the private sector do this. They've done it very well at no cost to the taxpayers. And so I wanted to say those few things just to get started with. But first, Mr. Zern, I want to go to you and Ms. Franklin both. Do you see these private exchanges expanding? And in other words, you went from a system where you were self-insured to a insurance plan like that. Do you see that happening? Is that going up? I love the idea of these private exchanges.
So,
Yes, you can start with
so we certainly see continued steady growth in the exchange portfolio, and across the definition of exchanges, we absolutely expect to see continued growth, not only within ours, but just as the industry defines exchanges and what is happening in the private healthcare exchange.
And why do you, Ms. Franklin? Because when I was mayor of our local city, we had 1,000 employees, 1,500 teachers or so, and we were self-insured. What reason did you make it at Hallmark to switch from a self-insured plan to the...
The primary model that Aon has used is a fully insured model, and part of that model is to put the responsibility and accountability to the carriers as they seek innovation in healthcare. To your specific question about the growth of this program, I do think we've seen with our employees coming into the workforce, they value choice. They don't want one size fits all. They appreciate being able to learn and customize a program that meets their needs.
And I think by allowing those consumers to have that voice and choice, I think you have empowered them. I think there's no question about that. The other thing I want to get in my little bit of time left is, and this goes to maybe to Fitbit, we need data to make clinical decisions. I have to have that to make a rational clinical decision. I think and I certainly, Ms. Collette, understand where you're coming from with maybe someone is coerced into doing something. We don't want that either. But we also need that data to be able to make decisions about, are we doing the right thing? Otherwise, we keep doing, as Mr. Polis just said, some of these wellness programs may not work, and a gym membership's not a wellness program. So how do we protect the data? And yet, so I can use it, so I don't know my cholesterol's my cholesterol. I could put it out there and you would know it's Phil Rose.
Thank you for the question. Fundamentally, I think it goes back to what you suggested, which is giving the consumer the choice to who and when and what data they share and with whom. So there's a responsibility on Fitbit in this case to make sure that the data is secure and that privacy is respected. And then by giving the employee or the individual the availability to share that data with their practitioner in the future so that they can have a better and more informed conversation, I definitely think is where the market is growing, and giving it's empowering the consumer and also the practitioner to be able to have that conversation.
I'm going to gavel myself down over time. I want to thank the witnesses today. You all have been terrific. I have thoroughly enjoyed this. It's always nice to have a hearing you know something about, which is healthcare. And I've really enjoyed hearing what you have to say. I think it's been very beneficial. We want to continue this discussion. And I want to thank you all for taking time to prepare to come today. And at this point, I'd like to ask Mr. Polis if he has any closing remarks.
And I'll be brief. Thank you, Mr. Chair. Thank you to our witnesses for a very thoughtful and thought-provoking discussion about how we can reduce costs, improve health outcomes in our employer-based healthcare system, employer-sponsored insurance has been very popular, is very popular, will likely remain very popular, and we need to do everything we can to make sure that businesses and healthcare consumers have the right incentives to provide additional wellness-based options and new programs to employees to help save costs and to make workers healthier. I'm excited about the role and the potential of technology and data to be very central to the decision-making process at the employer level and within private exchanges as well. It's heartening to see companies that are taking a close look at new and more efficient models for delivery that can cut costs and improve outcomes. And I think we only scratched the surface today, Mr. Chair, and we'll look forward to a lot more information for policymakers to make informed decisions about how we can encourage these kinds of activities in the marketplace, and I yield back.
Thank you, gentlemen, for yielding. And just to finish up, I agree with much of what Ms. Polis said, and we have created a system in the public system, and Ms. Franklin has a premium support. Basically, it's a defined contribution for health care, and you get to choose as a consumer which one of those. And Mr. Zern clearly pointed out that consumers will decide where their providers are, where they go to the hospital, what doctors they see, what medications they can receive. That's empowering people to make those decisions. We need to do more of that. And what do we have in Medicare and Medicaid is an archaic, out-of-date system. It needs to. That's what the system that needs to be completely redone. It's completely archaic. I mean, we have a Medicare system that has an A, a B, a C, and a D, and the day I turned 65, nothing happened except I got 65, except I now had an alphabet to go through about what kind of health care I wanted. I knew exactly what I had the day before. So those are the kinds of things I think this hearing has been, you really ferreted it out very, very well. And I do believe, absolutely believe, that the wellness part, and one of the questions I didn't get asked was, how do we take this technology and how do we, look, in a big company at Georgetown where they're highly educated people, it's really pretty easy to do. But as I walked into the office today, I walked by a lot of people who are not very sophisticated. And I live in areas that are not, and I want to know, how do we get that information down to where we can make a bigger impact, which is our low-income people and other folks. I think we didn't delve into that, and maybe that's subject for another hearing, because I think it's critically important. That's where your biggest gains will, quite frankly, be. Well, with nothing further, I appreciate very much you being here. The meeting is adjourned.